give you a little good news. Actually, I'm going to let our Director of Aging, Ursel McElroy, member of our cabinet, give you that good news. But as a kind of a lead in before we get Ursel on here, throughout the pandemic, older Ohioans have certainly been particularly hard hit. Seniors who live in a congregate setting are susceptible to the spread of the virus, probably more so than others. At the beginning, our nursing home facilities and assisted living facilities were closed to visitors. And we did that early on to protect the residents and to protect them and the people who work there the best that we could. We know, however, that this was hard, and it was hard for the residents of nursing homes, residents of assisted living, and it's hard for their families. And so on June 8th, outdoor visits have been permitted at assisted living facilities so long as all safety standards are met. Those same type visits we started allowing at nursing homes on July 20th. So since June for the assisted living and since July for nursing homes, outdoor visitation has been allowed. And again, I know I continue to get calls about this, and I know the Lieutenant Governor does as well, and Director McElroy does. But outdoor visitation has been open since June and July. We leave it up to the nursing homes to set how that's going to occur. So if you're not getting that visitation now, you need to talk directly to your nursing home or to your assisted living. They may have a good reason for doing it, but you should talk directly to them about that. But we know as it's a beautiful day out today, but we know it's going to get cold. It won't be that long. And we know that outdoor visitation will no longer work. So we have been working on coming up with indoor visitation. And Director McElroy, I'm going to call on you now. I see you on the screen. And if you can tell everyone what our plans are as we move forward. And I think it's good news. I think people will be happy with it. And it's being done in I think a very responsible way. And the director has been working on this, I know, very hard. Director?
Thank you, and good afternoon, Governor. Always good to see you and talk with you. So along with thousands of nursing home and assisted living residents and their families, we've been waiting for this day. So you're right, I do believe this is really good news. For the residents, families, and advocates, we certainly feel your same jubilation about this. For the staff of the facilities, we join your feelings of happiness for your residents, and we also join your feelings of concern about the health risks for these same residents, risks that we know haven't changed and risks that won't change until this coronavirus emergency is past us. I also want to take a moment to acknowledge the strain that has been felt by residents and by their families, and to also acknowledge the strain that has been felt by the staff who care deeply and wish for reconnection of the residents and families because they know how very important regular connections are to physical health and mental well-being. And for the families who have lost their loved ones when there were restrictions in visitation, we sadly and humbly acknowledge your grief. And we wish, like all of you, that things were different. As the governor has mentioned, we have talked with countless families. We've heard, we've felt, and in fact, we still feel the heartbreak. And I can only offer that our hearts are all with you. So with the expansions of visitation now into indoor, I want to talk a bit about how we got here and what that's going to look like. As the governor mentioned, those prolonged loss of connections are critical. We've heard from families, residents, advocates, and we've consulted with many aging professionals, public health experts, and industry representatives. And I'd like to give a particular call out to the Academy for Senior Health Sciences, Leading Age Ohio, the Ohio Assisted Living Association, the Ohio Healthcare Association, and the Ohio Medical Directors Association for working alongside us. We also are moving in a direction where we are aligned with our federal partners, in particular the Centers for Medicare and Medicaid Services. And as the governor pointed out, the weather. We know that the days are getting cooler, and they're getting cooler pretty fast. So, Governor, you often remind us that we can do two things at once, and this is certainly true as it relates to our next phase of visitation. It's important for everyone to know that indoor visitation does not signal that we can be less cautious. What it means is that each of us, residents, families, and staff, need to be even more vigilant in practicing the very basic yet very critical practices that limit the spread of this virus. Wash your hands, wear a mask, keep your distance, limit your visiting time, and most of all, stay home if you think that you've been exposed or are feeling ill. On top of COVID-19, we're also going into flu season. So we want every resident to be as strong and as healthy as possible. And remember, when you enter one of these facilities, you are entering someone's home. And to that point, for families who are visiting, always remember that you are walking into the home of not only your loved one, but into the home of their friends and others. So in addition to the basics of mask and hand washing, also stay tuned in to the level of spread happening in your home area. If it is high, that means that your risk of exposure is also higher if you've been out. It is so important that we all do our part. When you walk into a nursing home or an assisted living facility, all of us can unknowingly be carrying the virus and unknowingly spread it to residents and staff and their respective families. So, what can you expect with this indoor visitation? I want to first remind you that this is a first step of others to come as we responsibly restart our indoor phases. So first, the facility has to determine its level of readiness to facilitate indoor visitation safely. So they have to, one, consider the case status in that surrounding community. So they have to examine community transmission. Is it low, medium, or high? Two, they have to consider the case status within their facility. Are there COVID cases in the building? Three, staffing levels. Do they have adequate levels to care for residents and safely facilitate the visits? Four, do they have access to adequate testing for residents and staff? In other words, are they compliant with the testing guidelines that apply to their respective settings? Five, personal protective equipment supplies. Do they have the masks, shields, gowns, gloves necessary? And do they have local hospital capacity? In other words, should their facility have an outbreak, does their community have the resources to manage it, or do they have alternative arrangements in place? There's some things that are expected at a minimum for all of the facilities. One, they have to limit entry to personnel who are necessary for the operations of the facilities. So that's going to look like your healthcare providers, your governmental representatives, and regulators. But it also includes hospice personnel who provide core services, clergy, and hairstylists. They have to screen all staff and visitors upon entering the facility. They have to maintain a daily log of individuals that enter the building. The visits must be scheduled in advance. They must occur in designated visitation areas. They will be allotted 30 minutes maximum. And this makes it possible to have a meaningful interaction, but it also allows more families time to visit. And it gives the facilities time in between each visit to sanitize spaces. 2 visitors are permitted per resident per visit. And while there is no set age for the visitor, you must be able to social distance and wear a face covering. It's important to note that all visitors will be required to wear a mask supplied by the facility. In addition to regular visits, visitation will also be permitted in compassionate care situations. So this is not reserved for end-of-life situations only, but on occasions where compassionate interaction is vital to the quality and preservation of life. So a few examples would be maybe a resident who is grieving after a loved one passed away. Or perhaps there's an individual who needs cueing and encouragement with eating or drinking, or they may be experiencing weight loss or dehydration. Or perhaps you have a resident who used to talk and interact with others, but is experiencing emotional distress, seldom speaking or crying more frequently. We also are going to permit communal activities with safety protocols and distancing. So being able to eat together, being able to participate in activities together, but in a safe manner. The facilities will have to develop a written and transparent plan with these new requirements so that families and residents are fully informed and have an appreciation of what to expect upon arrival. And it is our expectation that facilities will not restrict visitation without a reasonable clinical or safety cause. The other piece that's really exciting is that the facilities will also regularly report visitation information to the state via an online dashboard that will be accessible at www.coronavirus.gov. And it will be launched when indoor visitation begins. And this dashboard will be very important in helping family members understand and make decisions around visitation. So, with a few easy clicks, you'll see the status of outdoor and indoor visitation, maximum hours for a visit, maximum number of visitors, and contact information for the facilities. So at this point, I want to close, Governor, but I want to close by restating what we've already said, and that this moment in time, albeit a long moment in time of this COVID emergency, belongs to all of us, to every Ohioan, and we own our behavior, and our actions and inactions are going to be so critical. So simply by remaining focused and following the essential steps to stay safe and to keep those we love and those around us safe, we can do this. And I am really excited. Thank you, sir, for the opportunity to talk about this.
Director, I'm sure that's very good news to many families out there. So to summarize, they'll be able to go up and look at a dashboard and see if they have a loved one in a particular nursing home. They can look that nursing home up and find it. And again, how do they find that?
I'll go to www.coronavirus.gov. We intend to launch it when indoor visitation begins. And I think it will be a helpful tool for the families, for the communities, and for the facilities.
Okay, and that visitation will start when?
Well, sir, I was going to give you the honor, but if you allow me, I'm happy to say it will be October 12th. October 12th. This gives the facilities enough time to prepare their physical plans, share information with families, and just to have a really good transition.
So by October 12th, facilities, we hope are ready. They can start that. And by then there'll be this dashboard up where you can go look and find what the contact information is and what the rules are and how you do it.
Yes, sir.
Okay.
Yes, sir.
Director, thank you very much.